to make today useful for you and increase the chance you're going to actually impact your patients from anything you hear today is to understand fundamentally the common factor of people who increase their healthy behaviors. They start with assessment. I'm a firm believer it's pretty hard to change what you're not aware of, right? So but don't try and change anything. Just start measuring things. And what do you see? People go, oh, wow, I guess I didn't realize I was doing that, right? Or doing it that as often. And if you do assessment correctly, it will point toward those specific behaviors that you might want to kind of target for change first, because they're going to have the biggest impact. So we'll be doing some kind of a self-assessment stuff in terms of physical activity, but also sleep hygiene, things that will promote sleep quality. Kind of very quickly, a digestion recall, looking at how the energy and the quality of the energy we take in through our gastrointestinal system is going to affect the energy output that we're going to have going out. Feelings, whether it be somatic feelings or emotional, kind of where am I at, is it worth attending to? And at the end of the day, I'll be talking about self-care. What kinds of things are you doing to increase your resilience against burnout, given the high stress levels we all experience? So the repeated question is going to be, for you, what will be different next week? Because we know if you can take on just 2 or 3 different actions as a result of what you hear today, you will be a much better advocate for your patients in the weeks, the months, and the years to come. Now, there's 2 reasons why treating fatigue can be enigmatic. I mean, it's really difficult to get our hands around this. One is because of the language we use. We don't have a common language. It's like, is being pooped out, is that more severe than being tired or fried? You know, is being drowsy, is that really the same as being exhausted, or when someone says they're just done? But probably more importantly, that kind of contributes to the confusion about, quote, fatigue, is there's so many causes of it. It can be sleep disorders, sleep apnea, perhaps. It may just be a urinary tract infection. We all know that when we have an infection going on, we just almost shut down. We just have very low energy, and it actually directly affects our mood, not just because we're not productive, but because of the inflammatory processes that happen on the brain. Could be kidney disease, immune dysfunction. The medications we're taking, certainly propranolol, beta blockers, medications for blood pressure regulation, can just be one more thing that contributes to low energy. Could be chronic fatigue syndrome or fibromyalgia, or in fact dehydration. Again, the data I will share with you about how important our intake of fluids can be in our energy regulation.